Next, we'll have Dr. Robert Kinscherf. He is a forensic and clinical psychologist and an attorney who has long studied violence and prevention, and he's examined ways to handle at-risk youth. He's here today to talk to us about the legal aspects of gun violence and what to do about this epidemic. Please join me in welcoming Dr. Robert Kinscherf.
Good morning. Sometimes it feels like when I'm invited to come give a conversation or participate in a conversation and I'm the identified law and policy guy, I feel sometimes like I'm running the risk of being the porcupine invited to the Hug Festival. Because law and policy are blunt instruments, and Bismarck, the German leader from the 19th century, properly observed that the two things no human being should ever be forced to watch is the making of sausage and the making of law. And I suspect that in coming weeks we are going to be seeing a lot of sausage grinding as we try and mobilize ourselves to address gun violence in the wake of this continuing epidemic. I use the word epidemic quite intentionally because I think the way through this thicket is not through another war, as Jim has already commented on, but a process that is actually fairly familiar to us and has worked in other venues. In 2013, APA adopted an approach to gun violence policy that rests very heavily on a public health approach to gun death and injury prevention. So just as a quick reminder, let's think about sort of the three levels of public health prevention and intervention, because one of the key challenges for us as we sift through what the proposals are to think about at what level are we trying to operate of the three levels, and how are we going to align law or public policy in order to support some aspect of one or more of these three levels. First, of course, is universal public health approaches. These are broad general population prevention measures. They're big ticket. They're the sort of thing that are slow and ponderous, but really kind of catch the social determinants of illness, and in this particular case, the pathogen being gun violence, upstream. So the more that we can correct social determinants upstream, as a primary prevention, a universal strategy that touches all the citizens in our population, and this will include things like education, access to adequate literacy and vocational training, access to adequate health and behavioral health resources, community safety, and the like. Those take big shoulders and long time, but they're very important, and in some cases, with this particular topic, also are going to ask us to look at things that are structurally very difficult in our particular country, one being institutional racism, and the other is the extreme and expanding income inequality, which creates all kinds of ripples downstream. The second level is selective, where groups who are seen as at greater levels of risk for manifesting a condition are thought of as separate from the general population and as requiring different approaches, different communication strategies, but we're still working largely with prevention. So in the world of delinquency generally, or youth gun violence, young adult violence in particular, the kinds of things we'd want to be thinking about as strategies for selective intervention are public health communications regarding violence, concrete, specific methods inside of individual communities, neighborhood by neighborhood, sometimes even block by block, to get as many youth as possible access to positive youth development resources, and to think about them in terms of their subpopulation characteristics. Indicated intervention is when individuals are in high-risk environments who are predisposed or already showing signs of the difficulty you would like to address, preferably as soon as possible. These would be the highest risk environments within the subpopulations we've already identified. And we know that this strategy works because we've seen it work with a variety of different other public health approaches or problems in their time. Automobiles, for example, used to be, still are, but used to be even more deadly machines than they are now. Toxic household products and children being poisoned in their own homes, infectious diseases and others. And gun violence should be viewed as a target for a public health approach. Because we have many of the other features seen in public health campaigns. We have an identifiable common denominator. In this particular case, firearms, and most specifically, handguns. It's impossible to have a handgun or firearm lethal incident unless there is a firearm involved. We have identifiable pathways that either increase or decrease risk of this behavior occurring. We have identifiable populations at greater and at lesser risk for the pathogen, if you will, emerging. And we also know that, like infectious diseases, gun violence also has bursts of contagion, especially in environments or under circumstances which tend to exacerbate the risk factors and diminish protective factors. Now, one of the challenges us for here today is to appreciate that for public health approach to work, we can't be talking about the gun violence problem. We do not have a gun violence problem. We have several and distinguishable gun violence problems which will each require a different way of approaching identifying the problem or defining the problem and crafting a solution. So, for example, just breaking it out into three large component parts, we have gun violence in the form of homicide, gun violence in the form of suicide, and there's about two-thirds of gun deaths are the result of suicide. We also have accidental injury and death as a result of discharge of a firearm. Not one approach is going to fit them all. For example, we know that simply in the world of persons who commit suicide, that there are some groups who are at greater risk of committing suicide than others. And it's also true that in the world of homicide, there are some groups that are more or less likely to commit homicides or to be victims of homicides. But there are some common strategies for our common denominator problem, which is access to guns, and I'll talk about that in more detail in a moment, although we're fighting a little bit against odds since there are 395 million firearms, mostly handguns, in the United States, and there are also distinct patterns of ownership and distribution that we would need to parse out for ourselves. There are different strategies for different types of gun violence. Even if we agree that gun violence is what we want to focus on, just in the world of homicide, we may need different strategies to address the risk of homicide in situations of intimate partner violence, gun violence associated with criminal activity, gun violence motivated by ideology or hate, gun violence motivated by small group conflict in neighborhoods or in communities. These are all gun violence problems, but they will call for different kinds of solutions. We'll need different strategies for different higher risk groups. And so, as I was mentioning before, what may work for urban youth of color, although their rates of homicide and gun violence vary extremely widely across communities, this sort of raises the question, what are the differences, even when there are large populations of urban youth of color, that keep gun violence rates higher in some similarly situated communities than in others? And also just thinking about what we would need to do about an intimate partner violence, ideological or hate-motivated homicide, intimate partner violence, and the like. It's tempting for us as psychologists to take the bait when somebody says we need to pay attention to mental health. I mean, who couldn't be in favor of paying attention to mental health, although we know that the link between gun violence specifically and mental health is a very complicated question, and its actual contribution to the overall risk scenario is quite modest. This is particularly the case in urban youth violence until and unless we begin thinking about what are the consequences, as Jim was talking about, of multiple exposures to adversity and living in an environment where you could reasonably perceive yourself as threat. Now, one of the things that has to happen in a public health approach is you have to have good data, and you have to then use the data that you get. Unfortunately, because of restrictions on federal funding and use of data and sharing of data, we don't have the kind of data availability and quality that we would hope for. But we do have enough to make us think a little bit about what we would want to do. So what does the current research tell us about the impact of gun policies? The RAND Corporation recently did a very nice study collecting the existing research on different policy approaches. And in some ways it's very heartening because it demonstrates that some approaches will work, and in some ways it's disheartening because we either don't know enough or we think it may not get to the heart of the problem we're talking about today, which is urban youth and gun violence. So background checks, do they work? Yes, especially if they're universal, but their greatest impact is on the lowering of suicides. Bans on assault rifles and large magazines, limited impact. Very few people commit suicide with an assault rifle. Assault rifles are commonly used in mass attacks, but most of the carnage that is being inflicted in our urban communities is by handguns. And so an assault ban, rifle ban, would not have the impact we might hope for simply because they are not, at least to date, relying on those weapons. Child access laws, it lowers suicide and it lowers accidental injury and death amongst children. Minimum age requirements, again, the impact is on suicide. Risk relative to mental illness, it may lower the suicide rate and perhaps amongst a small number of people, violent crime, but not necessarily gun crime in particular. Stand your ground laws. The research that we have suggested it modestly increases violent crime. Gun back laws, the buying back of guns, not a tremendous amount of evidence for its enduring impact. Red flag laws, yes, but again, it's mostly effective for lowering suicide rates, perhaps intimate partner violence, but not very much impact on violent crime, especially if it's violent crime in small group conflict or in criminal enterprises. We could talk about others, and there's been some very interesting kinds of proposals. Most recently, Senator Warren suggesting a federal licensing statute to federalize the licensing of guns, or proposing increased taxes on firearm manufacturers, partly to make the products more expensive, but also to create a financial kitty, if you will, for trying to subsidize interventions. There are, however, promising directions to addressing gun violence amongst urban youth of color. They are probably not going to be the big ticket items like universal legal checks, because most of the weapons that are used in the urban areas of our country are illegally diverted. They're stolen, they're legally purchased someplace else and brought into the community. They're not really going to get caught in the short term by universal background checks, and they're rarely done with assault rifles, as I had mentioned before. So we're really talking about the level of a kind of this second and third levels of public health intervention. We're really trying to craft very specific kinds of interventions, and like all other kinds of interventions that are public health in nature, at the end of the day, they're going to require sort of the version of health workers. Health workers who go into areas where there are epidemics of infectious disease and literally on a case-by-case, neighborhood-by-neighborhood, family-by-family, community-by-community basis, engage and address the underlying causes in ways that make sense to the people who we are most worried about becoming involved in handgun violence. Some of these include the READY program here in Chicago, ROCA, which is based out of Boston, Cure Violence, which has a history here in Chicago and also around the world, the Gang Reduction Youth Development Office in Los Angeles, College Bound in Dorchester, Massachusetts. There are all kinds of things that we have increasing evidence to believe actually work. But what we need to do is relentlessly focus on engaging with youth, their families, and their communities. The secret sauce in violence prevention is consistent engagement to allow people to make meaning of their lives in ways that don't include the aggressive use of armed violence. focus on the highest risk need youth, with the most extensive violence affiliates and families, culturally informed, getting into place people who can identify emerging conflicts between groups of youth, neighborhood by neighborhood, block by block sometimes, engaging to change individual, family, and community norms and expectations around aggression and violence, and continually collecting and analyzing data to measure outcomes and refine our approach. The stakes are too high to rely upon ideology and comfortable beliefs. This is one of these cases in which we really must allow the evidence to drive policy and law, even if it sometimes takes us to places that may not have been our first choice as we started off. It is difficult, if not impossible, to effectively address gun violence amongst urban youth of color without addressing the specific components of the well-documented cradle-to-prison pipeline that lives primarily at the toxic intersection of race and poverty and institutionalized racism, and is part of what is absolutely required to drawing down the war zones in which so many of these youth are living. So I'll close just with a couple of thoughts. There are things that we can try because they appear, at least anecdotally, to have been helpful when people have done them, but we need to do it systematically and collect data. For example, gun courts. For example, reviewing youth for diversion, pre-arraignment and post-arraignment, creating opportunities for positive youth development engagement in their communities, understanding that it may be necessary to use the law, particularly the criminal law, as something of a stick, but understanding that the law is a blunt instrument, and by using the law, it often results in inadvertent consequences that make the problem it was intended to address even worse. If you're a psychologist, what can you do? First off, if you're not politically involved in your own community, candidates matter, policies matter. If you have expertise that you can bring into communities for prevention purposes or to help inform people clinically on responses to situations or communities where gun violence is prevalent, there's all manner of things that you can do. Please feel free to contact me if you want to have sort of a little jawbone session on what you may be able to do with your own community or with your own talents. But the problem is not that there is a lack of things that you can do. The problem may just be looking at you in your individual professional life, your individual personal life, and say, what can I bring? What level of the public health campaign would I bring it to, and how would I know that I have maximized my effectiveness for these very vulnerable children and families? Thank you.
Yes, the stakes are too high to rely on ideology. I heard that statement loud and clear, and I also heard a little bit of applauding when you addressed race and the prison to pipeline, the pipeline to prison, excuse me. I just have a couple questions for you. In your presentation, you referred to the gun buyback programs. Here in Chicago and St. Louis, Baltimore, and some other cities like New Orleans that have really been impacted by gun violence. Gun buyback programs are ways for communities to involve themselves as being a part of the solution. But you say that there's no evidence that they work. What then should these communities be doing?
Maybe refine this. The record on gun buybacks is equivocal at best. Some of them, they've appeared to have very little impact, sometimes even inadvertent consequences. So, for example, in at least a couple of communities, once people learned that gun buyback programs were happening in a certain location, the people who wanted to buy a gun off market just showed up a block away and offered to buy the guns of the people who were bringing the guns in for the gun buyback. Most of the time, the guns that are turned in are old or they don't work. They're very rarely the 9mm, the 40 calibers, the 45 calibers that are really the machines of death. Now, that being said, I'm not opposed to them. If we get one dangerous weapon off the street, that's a good afternoon in my world. So I'm not saying that. I just wouldn't say it's the point of the spear of an effective public policy around diminishing guns. There are lots of things that people can do. They can support gun buyback programs. Perhaps we can refine them. Some places have decided to try paying an extra premium to get off the streets dangerous guns of the right calibers in working order. So we maybe see that some tweaks of the model be very helpful. But I think what we really want people to do, since they have the impulse to engage, is to engage in local gun buyback programs. I'm not suggesting that we stop them, but there are also so many other places where people can engage. Youth programs, helping identify the kids who are at greatest risk and figuring how to get them to positive youth development, resources like social and recreational and leisure activities, things that build on competencies other than their competencies as essentially child warriors or child soldiers. I've talked and worked with kids who have committed homicides for more than 30 years, and you know what? They were all really good at something else too.
Yeah.
It's just that the world had not yet figured out a way to help them create a meaningful life that built on their considerable intelligence and talents. And many of them genuinely believed that they lived in a world where they would either be in long-term incarceration or dead by the time they were 20. And so why not live the life of a pirate? You know, if you're gonna go, you're gonna go. Well, those are values and attitudes that we can shift in conversations with individual children, in conversations in which we involve them. They have to be active crafters of their own future that just can't be, you know, the adult sock monkeys talking to them.
Yeah. So the key word there is involvement.
Absolutely. Community involvement, whether you decide to do the kind of street level work that public health is very familiar with, or to help people do their jobs better by help training and equip them with skills. But it's also important things like, who is your district attorney? What is their policy towards diversion? What is their policy towards bail if somebody who otherwise does not seem to be a problem in the community is caught with an illegal weapon? So.
You talk about the district attorney and what their policy is and how they will enforce crimes or how they will view crimes. There's a conversation that is emerging about how to handle young people or just residents who are caught with unlawful weapons. They haven't registered them. They may have not committed a crime with them, but they've been caught with a weapon. I wonder if you can kind of weigh in on that conversation, because there's one tune of thinking that if you arrest people with guns and put them in prison, then you've prevented them from committing a crime. But on the other hand, then you've increased the prison population.
Which over time tends to increase crime. Our recidivism rates are terrible in the US. But let me sort of say, I like the way Jim sort of thought about how we need to shift the focus. So right now, when a kid is caught with a gun in many jurisdictions, this is thought of as a criminal encounter. Right, sort of end of story. And the kid sort of goes into the machinery, the arraignment is issued if it's an indictable offense in that jurisdiction, and there they go. And they may sit in jail for up to a year or more before the world even decides whether or not, as a matter of legal fact, they are actually guilty. Imagine a world in which if a kid is found with a gun, or a young adult is found with a gun, before we started the draconian machinery of the criminal justice system, we asked first the question, who is this kid and why is he carrying this gun? Right? Because criminal justice is extremely expensive, it's extremely punitive, and we have horrible, horrible recidivism rates in this country. So I'm not sure I want to automatically march every kid down the road. In the olden days, some of you who are public health historians may remember this, in some places it was a criminal offense to have syphilis. Right? Now you can imagine locking up people with syphilis is not going to solve the syphilis problem, right? What we have learned, and that I think we can get good at, although it opens complicated doors, is that if a kid is holding a gun, having a gun, we can ask, does this kid have the 4 characteristics that Jim talked about? Is this kid in a context where he's using it defensively, carrying it defensively, or is this in furtherance of criminal enterprise? Even if we think that a kid needs to go down the rabbit hole of the criminal justice system, we've had good success with drug courts and with mental health courts. There are some places that are beginning to do gun courts, because not everybody who is found with a gun needs to go to prison for 1, 3, 5, 10 years. So I think if we turn this into a public health encounter, or a criminal justice encounter that has a public health component, it's also an opportunity to engage with that same kid. And if we do our jobs right, because we see this a lot where you have progressive juvenile justice policy and practice, you can return those kids to their communities safer the day after you arrested them than the day before you arrested them, if you invest the resources to find out who they are and why they're carrying that weapon.
Thank you so much.
Thank you.